Coccydynia or tailbone pain, Clarendon Chiropractic. Coccydynia, tailbone pain. Coccydynia, or tailbone pain, can make daily tasks difficult and even impossible. The small triangular bone located at the base of the spinal column can become bruised or even broken. Walking relieves pain while sitting increases it. The best ways to reduce pain are at-home treatments and changing your habits, such as sitting too much. What is tailbone pain, coccydynia, and how can it be treated? Coccydynia, also known as tailbone pain, is a condition that causes pain around your small triangular bone, located at the bottom of your spinal column, just above your buttocks. What is the tailbone coccyx and how do they work together? The coccyx is composed of 3 to 5 fused vertebrae, bones. It is located beneath your sacrum, a bone structure at the base of the spine. It is connected by many tendons, muscles, and ligaments. When you sit down, your weight is supported by the coccyx, 2 bones at the bottom of the pelvis, and the ischial tuberosities, 2 bones at the top of the pelvis. What is causing my tailbone pain? Tailbone pain can range from a dull ache to a sharp stab. This can last several weeks, months, or even longer. How common is tailbone pain, coccydynia? Experiencing tailbone pain is common. Coccydynia is 5 times more common in women than it is in men. It is more common in adolescents and adults than it is in children. Obese people are 3 times more likely to get it than those who weigh in at an ideal weight, according to the BMI, body mass index. Symptoms and causes. Falling. There is no one who hasn't fallen on their backs. Perhaps your feet got caught on the ice and fell out of place. Repetitive strain injury. Bicycling and rowing demand that you stretch your spine and lean back. You can damage the tissue surrounding your coccyx if you do too much. Pregnancy or childbirth. The 3rd trimester of pregnancy is when a woman's body releases hormones that soften the sacrum and coccyx. This allows the coccyx movement during childbirth. Although this is natural, it can cause pain by stretching the muscles and ligaments surrounding the coccyx. Obesity. Additional weight puts additional pressure on the coccyx. If your tailbone is not in its proper position, it can cause pain. Underweight. You can have problems if your buttocks aren't fatty enough to keep your coccyx free from rubbing against muscles, ligaments, and tendons. Sitting. This simple act alone can cause coccyx discomfort, especially if you are seated on a hard surface or narrow surface. Cancer. Tailbone pain is a sign of cancer only in very rare cases. Is it possible for menstruation to cause tailbone pain, coccydynia? When a woman has her period, the pain in her tailbone is more severe. Diagnosis and test. What is the diagnosis of coccydynia? After reviewing your medical history, your healthcare provider will ask about any traumas, including those resulting from a fall or childbirth. The healthcare provider will then examine the area for any obvious fractures, deformities, or abscesses, infections. Management and treatment. How can coccydynia, or tailbone pain be treated? Many people are able to recover without any treatment. 90% of those who require treatment can use at-home remedies. To reduce the pain in your bowel movements, you can use stool softeners. You can strengthen the lower back and pelvis muscles by stretching and strengthening them. Is walking good for tailbone pain, coccydynia, or is it bad? Yes. Standing up and moving around reduces pressure on the coccyx, which can help to lessen pain. Prevention. How can I lower my risk of having tailbone pain, coccydynia? Avoid falling. Avoid activities that can worsen symptoms, such as sitting for prolonged periods of time and cycling. Outlook and prognosis. What should I do if I experience tailbone pain, coccydynia, and what can I expect? You can experience dull pain, severe pain, stabbing pain, or any other type of pain. The pain you feel when you stand and sit will get worse, as well as when you have a bowel movement or have sexual intercourse. Final note from Clarendon Chiropractic. The discomfort of tailbone pain is temporary but not permanent. Do not let your coccydynia become unbearable before calling your healthcare provider. Take your medications as prescribed, use your ice packs, take hot baths, get an air donut, and spend more time on your feet and keep those feet moving. If you are having lower back pain, call us today.